back, a naturopath. Thanks for coming back. I always like to see new people looking at my, and I can tell that you're a new person looking at my, maybe you're not, maybe you've looked at other videos. But anyway, if you're new to the channel, there's a lot of videos on this channel. Please take your time to have a look around. There's lots of stuff. And I'm doing a series currently on omega-3 essential fatty acids. So the question today is, how much omega-3 daily for women over 50? So I'm a guy who likes to get the dosages pretty good with people, not to give them way too much or not way too little, but sort of around the sweet spot somewhere. I did a video previously on the omega-3 index. So the omega-3 index, okay, is a test you can actually get done by your doctor. So some might find it a bit amusing or might not understand why the heck you want to know stuff like that that's going to save your life or improve your quality of your life. They still wouldn't understand it. Most doctors don't really know anything about omega-3, but you can ask for this test. You may need to go to a naturopathic doctor if your medical doctor is, doesn't really understand the test. But what the Omega index does is look at your red blood cells and at the percentage of fats in the red blood cell. Okay, so, and as I said in the other video, if you've got a 2.7% omega index, that means that 2.7% of the fatty acids in the red blood cell membrane, okay, are basically EPA and DHA or omega-3. Now, we really want to look at an omega index of greater than 5 or 6, so 8 is about the best where you can be in terms of cardio protection. Between 8 to 12 index is even better to get all the benefits, anti-inflammatory and cognitive benefits that omega can confer to you. So that just means that you're going to get more oil in your blood and that oil's going to work better for you, So how do you know? Well, testing's obviously the way to do it. But if you can't get tested, and I know a lot of people won't get the test or can't get the test or for some reason, I would recommend most women over 50 take anywhere between 2,000 right up to 6,000 milligrams per day. Now that may seem like a crazy amount, but if you're a lady sitting there with fingers all gnarly from rheumatoid arthritis, or if you're a person with Sjogren's syndrome, or scleroderma, or lupus, or an autoimmune disease, you need lots. Taking 2 is not going to do much, is it? You need more, especially if the doctor's got you on handfuls of other pills like steroids and things like that. So the women with the inflammation, the bad inflammation, need higher amounts than the women who haven't got this type of inflammatory level. But no matter what age you are, you're going to benefit as a female from taking omega-3 fatty acids. So I've just looked at my notes here. I'll provide daily recommendations in the absence of testing, however, as I know most women won't or cannot do this test for various reasons I just mentioned. These recommendations I give are based on my review of the literature on omega-3 and my extensive clinical experiences in recommending these supplements for over 30 years. As I mentioned, I've had many women take 4,000 to 5,000 per day for extended periods without any problem at all, and some even higher dosages. But I would say on average, for the average person like me, usually 2 capsules a day is more than enough. So if you're in pretty good shape and you want to stay in pretty good shape, take 2 capsules a day. If you've got a need for omega-3, if you've got diabetes or bad inflammation, you could easily go up to 3,000 to 4,000 per day. If you've got a serious inflammatory disorder, you could go even higher, but talk to the doctor or talk to your healthcare professional before you decide on a dose. And then don't give up in a hurry when you take omega-3. Omega-3 is not like a steroid or a powerful drug. You don't just take it and within 24 hours all the pain's gone. It doesn't work like that. All right? With high inflammation, you need for 3 to 6 months minimum before you're going to notice much at all. So hang in there. But the great thing about the omega-3 for females is it works on so many aspects of their health. Their heart, their brain, their bones, their muscles, their skin, everything, their eyes, it all gets a benefit. Whereas a pharmaceutical drug's got no benefit at all apart from symptom reduction. All right, that's the big difference. So average, most people 1,000 to 2,000 milligrams. Higher need, 3,000 to 4,000. Serious need, go up. All right, thanks for tuning in.